Hi, my name is Dr. Vinod Mattoo. I am the Medical Director and Chief Scientific Officer of Wellthy Therapeutics. Diabetes in India, we're passing through a very rapid phase of expansion. We are in the middle of a diabetes epidemic, and many people believe India is the epicenter of diabetes in the world. The prevalence rates that we have in India are approximately 7% of all adults suffer from diabetes. And according to WHO, the number of patients with diabetes in India is approximately 70 million people at the moment. This compares to about 90 million in China, and overall the worldwide figure is about 425 million people in the world. So we take about 15% of the global burden of diabetes here in India. Diabetes is not an easy disease to treat, as we have seen in the last few years. There have been a lot of advances in treatment, but it doesn't matter which country you study this in, approximately half of the patients with diabetes will never attain control. And that is fundamentally because the foundational treatment for diabetes is number one, diet and lifestyle interventions, exercise, etc. And treatments can do only that much. And even in the best centers in the world, only about half the patients are on control. The challenges and gaps in diabetes can be related to number one, to the comorbidities, because diabetes doesn't come by itself. It generally is part of a larger cardiometabolic disease. It is the commonest cause of blindness in India. Diabetes is the commonest cause of heart attacks in India, coronary artery disease. It is the commonest cause of renal failure in India. And after vehicular accidents, it's the commonest cause of gangrene and amputations in India. So there's a lot of comorbidity associated with diabetes that poses a significant challenge to the national health checker. The second problem is in the nature of the disease itself, because a significant component of how diabetes is managed is relating to lifestyle modifications and behavioral aspects of the patient and the family. Controlling this without significant involvement of lifestyle intervention is going to be extremely difficult, and that is why only about half of the patients with diabetes ever reach control. Digital interventions are increasingly becoming very popular in trying to help patients who need long-term behavioral nudging. For example, diabetes is a very obvious target for digital intervention. There's also digital interventions that have been attempted in dyslipidemias, in Alzheimer's, in sleep disorders. There is a scope for digital intervention in several other diseases that will act together with the pharmaceutical agent to help patients with diabetes. In the last 10 years, the FDA has begun to encourage companies to introduce and develop digital interventions for all sorts of diseases. In diabetes particularly, a digital therapeutic has been approved for prevention of diabetes. There is another company that has an approved product, a digital therapeutic product for titration of insulin and as well as for management of type 2 diabetes. So this has become regulated now. It's been recognized as a very specific therapeutic advance, a digital therapeutic that can be used along with a pharmaceutical prescription to help improve the outcomes of patients with diabetes. At Wellthy India, we have been investing a lot in developing clinical evidence and clinical data. Last 2 or 3 years, we have worked with different key opinion leaders and thought leaders in India. We have taken the backbone of the American Association of Diabetes Educators 7 as the behavioral platform, so to say, and we have indigenized and Indianized it with the help of several experts here. This program was endorsed by the Research Society of RSSDI, Research Society of Diabetes in India, and has formed the basis of our treatment algorithms in various disease populations. For example, we tried this in monotherapy situation, we tried this in combination with drugs, we tried this in combination with 2 drugs, and there is applicability beyond just diabetes. In dyslipidemia, there is applicability in heart failure, in respiratory disorders, and in the future we will be looking at other disorders as well. But specifically in diabetes, we have now more than 11,000 patients in whom we have used this digital therapeutic. We have data points running into millions of data points, and that has generated significant evidence not only on the value of the therapeutic but also on understanding the type of disease that we have and characterizing the disease in India and we have been able to publish this in various forums across the world. We have had a publication on our first pilot that we did 2 years ago, and we published that at the ADA. And we will be publishing 2 more shortly at the ATTD conference, which is based on a 16-week study that we did on our Wellthy Diabetes app. And even though we have published these results, depending on different patient population and clinical setting in different conferences, in summary, the overall thrust of the findings is very similar. The Wellthy app helps patients with diabetes in the following manner. Number one, we have shown conclusively that there is improvement in glycemic control by reduction of fasting as well as postprandial blood glucose, by reduction in A1C, and in the 2 papers that we will be disclosing at the ATTD, we have shown that the reduction in A1C was approximately 0.7 to 0.9%. What we have also shown, and it's very good to see, that more the app that the patient uses, the better is the outcome in terms of number of minutes of exercise that this patient has. In the paper at ATTD, what we're demonstrating is that before we started the digital therapeutic in these patients, the approximate time of exercise was about 3.5 minutes. And after this intervention, that increased up to 133 minutes, a very significant increase in the way patients then accept this technology, and it helps them convert into actual behavioral changes, for example, exercise time. With this, the improvement in A1C was shown to be approximately 0.9%. There was a significant change in both fasting as well as postprandial blood glucose, and overall improvement in diabetes parameters.